It takes a strong, supportive, and dedicated person to take on the challenge of helping children who are going through difficult times.
One of the things that you realize when you come to a children's hospital like Rainbow is that there are so many people that have devoted their entire professional life to caring for children in their community.
These are a few of the nurses at the Rainbow Babies and Children's Hospital who are truly making an impact.
Right now we are just about full, actually. I think we have about 12 to 13 patients. Night shift, it's a quieter atmosphere. It's a lot different than days. However, we still get to interact with the kids, which is nice. They sleep most of the night, and in the morning, we're usually there for them if they need anything. First person they see besides their parents, it's nice.
With each patient, I feel like you really get that tight bond to them, and you always hope for the best, and you always want everything to go exactly right.
There are definitely challenging moments, and we cry, we laugh, but you know what, it's such a privilege to be a part of the team that's caring for patients. Oftentimes they're going through the darkest moments of their lives, and we're right there with them, and they know that.
The families amaze me, how they pull together and how strong they are, and I feel weak compared to them. So I feel like I have to keep my end of the bargain when I'm here. And just getting it right, making sure it's right for them.
I think it gives us a better outlook on life. You're not going to get mad at the waitress at the restaurant or mad at the grocery store clerk who's working like other people do, because you see the reality of where life can be.
A lot of us have been impacted by cancer within our own families, and so we know what they need and what they look for and the support. I had a cousin that passed from cancer when I was 15, and this is where I want it to be.
So it can be hard. I mean, it's a difficult field. You do have patients that you lose, but a lot of them go on, and you see them become young adults and grow into wonderful people and take on normal lives. But truly the children that we work with are so full of life, no matter what they're going through. Every kid that comes through this door leaves an imprint on your heart.
A lot of kids are here for months at a time that we are able to build that relationship with their parents, with them, with their siblings, with their aunts, uncles, cousins, that it's nice to come in and just see that smiling face every day. Sometimes we're the first people who were there when they're first being diagnosed with cancer, so we're there when they first hear that word, because we work in the inpatient setting, so very often they come in pretty sick and we're there with them, and then they come back and they get their first treatment, we're there again. So they start to, I think we become part of that support network for them. Actually, when they first get that news, sometimes it's just a matter of sitting with them and letting them feel that, because it can be so devastating, so just to be present with them. And then we talk about, here are our treatments, here are what you can expect as you go through treatments, to kind of reassure them that they're not going to be going through this alone.
You have to just give them space, but then they know that you're there, and they're not alone. And there's a whole team of dedicated people who are here, really, just to use all the tools that we have to make things better.